What's up, you guys? It's Kristen Feemster, licensed therapist and wellness coach, back with another video under our Strength for the Struggle series. We are going to be talking about injuries and ailments, but from a different perspective of them being chronic conditions. Now, this is a little bit different, or a lot different, than an acute injury in that these are issues that linger, that we have to have a different approach to long term in order to cope with, to manage, and to move forward. And so this is a special area that I think is so important for us to be aware of, because most of us have something that is, a nagging injury or a chronic condition that we've been diagnosed with. And so this is a very real reality for a lot of us. And sometimes we don't stop to acknowledge the significance of it, not only in the acute point that we're diagnosed with it or that it happens, but in how it changes your life moving forward from that day forward in a way that sometimes can feel or seem invisible. Once you've been diagnosed with something, whether it be diabetes or autoimmune disorder or just having an injury that never healed quite like it was supposed to, the attention around that initial diagnosis has long gone, and then now it just is. And that can often make us feel like, okay, now what? Like it's still an issue, but it's not being tended to like it's an issue. And so how do I move forward without getting defeated by the condition itself? And so I'm going to give you some tips that I hope are going to help you to navigate this. I think it's something when we have a chronic condition, it's about navigating it differently. Some big chronic ailments that I hear about all the time: lower back issues for sure. That's probably number one. Tied in with like postpartum pelvic floor issues, which kind of, come hand in hand with a weak pelvic floor, a weak core often leads to lower back pain. But also we do a lot of sitting. We do a lot of lifting in ways that are not necessarily the best form. And so lower back pain is like the number one chronic ailment that people report and that people are struggling with and really just don't know how to continue their routine, continue a healthy lifestyle without really just being overcome by it. And then of course we have knee pain, hip pain, those types of things that come from maybe an injury that never really healed, or must I say, when we've been injured, not following through on the treatment recommendations. And remember, in the other video about injuries, acute injuries, I mentioned the importance of following through, especially on the physical therapy aspect of acute injuries, because those not adhering to those directions can often lead to a chronic issue that you can't always bounce back from fully. So it's so important to follow those instructions at the time and after. So for me, I've had 3 knee surgeries. And so anytime my knee starts feeling a bit achy or like unusual pain, it sometimes is because of something that I've done to it, through exercise, but oftentimes it's because I haven't done the rehab exercises that were prescribed to me years ago. I mean, my knee surgeries were over 10 years ago, all of them, close to 20 years ago. And even still, I can tell a difference when I am not doing my leg curls, my leg extensions, my single leg balance moves. I can already tell when I'm trying to perform exercises that I normally do, that I'm able to do, but only am I able to do those things well when I am staying on top of rehab exercises that were prescribed to me in my teens. So if you have been recommended to stay routine with certain exercises, certain stretches, I cannot emphasize enough how important that is to your quality of life overall. And then, of course, we have some of the more hidden issues, which is like conditions that we can be diagnosed with. You guys, this could use its own complete video, of just sitting with and accepting the reality of being diagnosed with autoimmune disorder or cancer or something like diabetes or really sciatica, multiple sclerosis, anything, that really just changes the way we relate to our body. Your body is your home. We don't always acknowledge it as such until we find that we're in a situation where it's been changed forever. And then in those moments, we're like, wow, this is really important. This is really shaking up my mental, emotional, and even spiritual world, in addition to the physical issue of it all. And so those are the types of things and situations where we have to figure out how to navigate it differently. It's not a good feeling. There's a lot of grief that's involved. There it's a work in progress as far as mentally coming to terms with being diagnosed with a long-term condition or something like that. But it is possible with grace to find a way to move forward. And so I want to give you some tips on how to do that. Something that I don't think that we're taught to do starting at a very young age is listening to our bodies. And that is the first thing that I want you to do. Regardless of what chronic issue or ailment that you have got to listen to your body. I think in the society that we live in, we are forced to override how our body's feeling, all the way down to not going to the bathroom when we need to go to the bathroom, and not eating when we need to eat, and not drinking water when we're thirsty. We are just taught to just keep going. Keep going, keep going. Don't worry about it. Don't worry about it. You have a headache. It's okay. You're dizzy. It's okay. You haven't used the bathroom in days. It's fine. We've got to learn to listen to our bodies, not only in the small, maybe seemingly trivial situations, but in these larger ones too. And so sometimes the conditions that we have been brewing for a while, and maybe we didn't know to stop and have a check. This could be going to your doctor on a regular basis and having those routine checks to make sure of things. But this is also a day-to-day practice. They teach us this with doing breast exams at home. When's the last time? Let's do a poll. When is the last time you did a breast exam at home, right? That is a practice of listening to your body. And I know that we have been recommended to do that by way of our doctor, a commercial, a breast cancer awareness, pamphlet. Something has told us to do that, but how often do we actually do that, to listen to our bodies, to get used to what our bodies feel like, to know when something is going on? And so if you are dealing with a chronic illness or chronic condition or injury, or if you aren't, either way, listening to what your body is telling you need to do is going to promote your recovery and your longevity with whatever the situation may be. So always, always, always take a moment every single day, multiple times a day, to listen to my body. Is my back hurting right now? If my back is hurting, maybe it's how I'm sitting. Let me respond. Let me move around. Let me get up and stretch. Let me actually listen to what my body is telling me, instead of thinking, oh, my back's hurting. It always hurts. I guess I'll just have to push through and figure it out. I don't know. I'll put a heating pad on it later. That sort of thing. We've got to learn as best as we can to respond in the moment. If you're doing an exercise and you have a hip issue or you have a shoulder issue and the move that you're doing is causing you pain, now discomfort is a little bit different. While you're exercising, you're bound to have some discomfort. Your muscles are working in ways that you haven't worked them in a while, or you're challenging them intentionally in ways that you haven't. And so you're going to have some discomfort with that in your muscles or just in your mobility, stretching, whatever the case may be. But if you're having pain, that is something to listen to. That is not something to bypass. So the first thing that we've got to learn to do more routinely is listen to our bodies. After you have listened and you recognize that there's something that you need to do, you've got to tend to it. And when it comes to tending is not just responding in the moment. Tending to is a posture. When you're tending to a child or you're tending to a garden, it is cultivating a space where health can thrive. Okay. And so it's like, I've got to tend to this. I've got to take care of this. I can't just take an ibuprofen or take an Aleve or just, go to sleep or, lay on the ground for an hour and then get back up and do exactly what I was doing before I even stopped. I've got to actually tend to it, take care of it. What does it need on a daily basis? What is the new routine to take care of this ailment and to respond to it? It's not going away, or maybe it's something that can be reduced, but it's something that I'm going to have to tend to and commit to tending to ongoing. And I think that's what most people don't do, is that we respond when the pain gets to a certain level, or we respond when the numbers come back at a certain place, or we have this complete drop in motivation and just, feeling defeated and grief around a certain diagnosis. But that tending to relationship that is ongoing is the hardest thing to maintain and the hardest thing to prioritize, because we're not used to it, but that's the best thing that we can learn to do, is that not only do I have to listen to what my body is telling me is going on, but once I have that information, once I have a plan, I've got to tend to it and continue to do that over and over and over again so that I can have the best shot at recovery. Tending to your body looks like stretching and mobility after your workouts, okay? Let's say you go to the gym, you've had a hard workout and you tweak your knee, or your knees just hurt because they just hurt, You've got to tend to that. That means that I've got to allocate time to stretch and to cool down for my workouts. I've got to make time to warm up for my workouts these days. You see what I'm saying? If I'm not thinking about it, then I'm just going into the workout, and then when something hurts, I just stop, and then maybe I'll start back. But tending to is adding in those intentional opportunities to cultivate health within my body, which includes a warm up and a cool down. Tending to some other conditions is taking heed to what doctors are recommending that can promote the best case scenario. And so a lot of times doctors will give us recommendations, and in the moment we say, oh, I'm going to do that. Yep, I'm going to reduce that. I'm going to increase this. I'm going to do all the things. And then 2, 3, 4 months down the road, we are not continuing to tend to them. And so a good intentional way to make sure that you're tending to is to set some goals for you that are specific to the condition that you have. And so it's easy to get a broad stroke, to get a broad brush and just say, I'm going to just be healthier and I'm just going to do better. I'm just going to do better. But tending to that specific recommendation is going to be sitting down and creating a plan of action of how you're going to tend to it. It needs some structure in order to be intentional. The last thing that you're going to have to do is you're going to have to adapt. Once we have come to terms with having a chronic issue or ailment, it can be really hard to go through the grieving process of life being different from this point forward. It may not hit you all at one time. It may be that you start to realize it as you try to move forward in the ways that you used to, and you simply just can't, or it's causing more issues for you on the back end. And so learning to adapt in those situations is hard to do, but it's also one of the most empowering things that you can do, because it's about accepting and realizing that this old way may not work for me. I may need more rest days because of the flare-ups that I'm having. I may need to change from lifting free weights and barbells to machines only in order to protect my hips and to keep myself from having to have a hip replacement surgery or, a knee replacement surgery or anything like that. But I've got to learn to adapt, because that's the way that I get to move forward. And so I'm not backing off of these things only because I have this condition. I'm backing off and changing and adapting how I move forward so that I can move forward. Your progress is not always measured by doing more and going heavier and running faster. Sometimes your progress is just about maintaining while life is just throwing things at you, right? And so I know it can seem like, man, I had so much momentum. I was moving forward, and then I got this diagnosis, and then now it's just like a full stop. One, acknowledge your emotions and allow those emotions to settle. But you've got to step back out to the bigger picture and see that there are some ways to move forward if we adapt. We may have to, come to terms with our old plan, our old way of doing things. Maybe you can't run anymore, but maybe you could start walking. That's a way to adapt and keep the essence of what you were doing, even though it looks different. And so redefining how your progress is to be measured is something that you're going to have to do in this space as well. Your progress could look like fewer flare-ups. It could look like having more mobility. It could look like needing less medication to numb pain or to take care of inflammation. These are all non-scale, non-performance related victories that are really about progress. That's really that would be a huge win if you could get to a place where I'm able to do a 30-minute, body weight or lightweight workout without any lower back pain. That is progress. Now, it may not be the old 45-minute HIIT class that you used to take, but moving without pain or moving more fluidly throughout your daily functioning is the win. So the mindset anchor that I want you all to take away for this situation is the so that mindset. And the so that mindset is basically accepting that something has happened, something has changed, and I am coming to accept that. And instead of taking on this mentality of I was doing so well, but then I had to stop because, or I can't do that anymore because you're going to take on the mentality of I'm having to tweak and adapt the way I do things so that. So the so that mentality is about moving forward despite adversity, finding a new way even to move forward because it's what's best for your current body, right? So it's the so that I'm going to adjust, I'm going to reduce, I'm going to do some trial and error with a new routine so that at the end of the day, I can find a way to move forward. If I'm so committed to the old way that I used to do things and I'm having a hard time coming to terms with it and I'm wrestling, not only am I not going to probably be able to move forward in the best way possible, but I may end up making things worse. I may have more inflammation, more flare-ups, more pain to where I really do create that worst case scenario of having to stop completely. So this is where you have to know that your injuries and your conditions do not define you, but they will be an opportunity to change the way you identify with them. Keep those things in mind as life happens. We don't know what's going to happen next. We don't know what news we might get. We don't know when we might encounter along the way. But as long as our mindset is in finding a way or making a way, adapting where we need to, tending to, acknowledging the situation that is presently at our doorstep, we are well on our way to facing that issue head on. Embracing the challenges of it, accessing the support that we need to move forward, and ultimately continuing to show up for ourselves no matter what. All right, you guys, so that is it for today's video. I hope these tips were helpful to you, and I will see you in the next one. All right, bye.